I'm going to explain insomnia VA disability ratings as simple as I possibly can, then show you the M21 TAC 1 reference, which was updated January 10th of 2024. I have multiple veterans, one being a member who requested this video, asking me about insomnia. So here is your answer as plainly as I can make it. Two things. One, unless insomnia is directly related to service, it basically doesn't matter. Insomnia secondary does not matter anymore. It must be direct. Now, there are some nuances with all things VA disability, especially insomnia, and I'm going to talk about that. And the VA leaves it extremely vague and kind of on an empty promise, and we're going to discuss on why I'm saying that. So let's go ahead and pull up the M21 TAC 1 and read this for ourselves. Now, it's about a paragraph long. We're going to read this, and you can see up here, considering SC means service connection, considering service connection for insomnia. You see part 5, subpart 3, chapter 13, 1, and I believe that's an L. So here we go. This is insomnia straight from the book. If you want to hate your life, go ahead and start reading M21 TAC 1 because this sucks. But carefully consider the evidence of record when deciding service connection for insomnia. Okay. Insomnia is generally considered a symptom of another disability. Kind of like what we see for tinnitus, right? The proposed changes for tinnitus, same wording here, due to coexisting medical or neurological conditions. Very common. Insomnia can occur as an independent condition or can be a symptom associated with another mental disorder, for example, MDD, medical condition, for example, pain, or another sleep disorder, for example, a breathing-related sleep disorder. Got it. That's insomnia. Okay. When insomnia is adequately identified as a symptom of another underlying disability, service connection should be established for that diagnosis rather than insomnia. Meaning, if you have tinnitus and your tinnitus is causing insomnia, doesn't matter. You have tinnitus with insomnia-like symptoms. Now, the issue I have with this, and the insomnia symptoms should be included in the evaluation for the primary service-connected disability. Tinnitus only goes up to 10, and so that's it. You're going to get 10%. Look at chronic pain in the example of the medical condition here, where it says pain. You know, if you're doing insomnia secondary to chronic pain, there isn't a way for the VA to adequately incorporate insomnia into that lower back rating. So that's my problem with this to begin with. And what you're going to see is insomnia is basically useless as a secondary. You might as well not even claim it. Now, a separate evaluation is not warranted for insomnia that is considered secondary to or a symptom of another disability. There we go. Insomnia is basically useless as a secondary. However, service connection can be established on a direct basis. I'm going to say that again, direct basis for insomnia in the absence of a known or established underlying etiology. If there is, and this is the big three right here, the in-service event, the current diagnosis, and the nexus, just like every other claim. So insomnia can be service-connected if it's direct. Now, there's also a hidden criteria here. The condition is not associated with any other disease or injury. I've never seen someone have insomnia just because they have insomnia and nothing else, which to me basically translates to it's useless. But I'm sure there's your onesies and twosies out there who genuinely have insomnia. That's not considered a part of anything else. Now, important note here, a separate service connection evaluation for a diagnosis of insomnia disorder is only warranted if all other potential causes are ruled out and service connection can be established on direct basis. So if you have anxiety, you're going to be rated for anxiety. If you have anxiety and insomnia, you're going to be rated for anxiety and insomnia roped under 1. And it talks about the DSM-5 criteria. Basically says how it's a underlying condition, right? Insomnia disorder, got it. And then you see the 38 CFR reference here. I'm going to pull that up really quick. It's just your general rating schedule for mental health. This is exactly how insomnia is going to be rated. Basically, what the VA is saying is if you have insomnia, you probably have anxiety, depression, or literally any other condition. Therefore, insomnia will be rated as that condition. So if your back is causing insomnia, your rating is going to say, lumbar sacral strain with insomnia rated at 20%. You're not going to have a lumbar sacral strain at 20% and insomnia at 50%. It's just one rating. So it gets back to the question, can you claim insomnia? The answer is yes. Can you claim it secondary? Yes, you should. I would still recommend it if you have insomnia and you literally have nothing else. You probably do. Okay. But let's just clear cut. You have nothing else except for lower back and insomnia. Should you claim it? My answer is yes, because you need the VA to recognize you have insomnia, get that diagnosis, even though the rating's roped in with your back. It's very likely, like if you're not sleeping, you're going to be irritable. That's going to cause problems in your work. That's going to cause problems in your relationships. That's going to develop into other mental disorders. And it's going to be a lot easier if the VA recognizes your insomnia rating from the get-go versus doing a whole new claim for mental health. It would just be a lot easier. So insomnia is basically useless. However, should you claim it? Yes, because the goal is to be properly rated. It's kind of like saying, I would look at insomnia through the same lens as an intermediate step. So are you going to get paid for the VA recognizing your obesity? No, you're not. However, the VA recognizing your obesity is due to service or a service-connected disability. That now opens the road up for sleep apnea, hypertension, diabetes, mental health, you name it. Same thing with alcohol use disorder. Insomnia is it's not, but through the lens that I would look at it is an intermediate step. So, hey, you have insomnia right now, but give it a few years, maybe even a few weeks. You may have some very serious depression, some very serious anxiety, maybe even some PTSD. It's going to develop into something else. So, yes, you should absolutely claim insomnia, although it's basically pointless. It's more so for follow-on claims in the future, unless, of course, that insomnia claim is direct. So your insomnia is directly caused from your time in service and nothing else, then sure, go ahead. It's going to be rated as mental health anyways, but that's when insomnia can be service connected. And there you go. There you have it. That is the update as of January 10th of 2024. It's useless except for follow-on claims. Okay, so not completely useless, but basically useless.